We recently visited Dr. Byron Gadsden of Gadsden Chiropractic Wellness Center in Norcross, and we talked about chiropractic care as it relates to personal injury, and here's what he had to say.
Chiropractic is the study of the musculoskeletal system as it impacts the nervous system. The majority of the clients that we see have typically low back pain, which is anywhere from L1 all the way down to S2, okay, on the spine. But the primary problem that we see most of the times is neck pain, from the base of the skull down to about T1 or T2.
I asked the doctor, with so much mystery surrounding chiropractic care, what exactly is the role of a chiropractic provider?
A chiropractor's job is to help facilitate the body's nervous system in healing the body and bringing about a level of homeostasis or a level of balance that the body does not have or has gone so far that it can't facilitate that healing. That's my job as a chiropractor. And I think a lot of people don't understand what chiropractic really is. They just think it's someplace that you go once you get in an auto accident or if you get hurt at work. I've always said that I wish that there was some level of legislation that could raise the limits for minimum coverage here in the state. I'll give you one example. Recently, as last year, 2013, I had a client that had as a result of a T-bone accident where one car barrels into the side of another car, making a T or T-bone. He actually had a broken collarbone. Unfortunately for him, the at-fault party only had $25,000 of liability coverage.
Many accident victims find it very difficult to get adequate care with the current minimums.
It cost $18,000 just to have that surgery. So there was nothing left for him to have any level of follow-up care or care during the process of getting well. So who lost out on that? Who lost out on that? The patient did. And unfortunately for him, he will never be the same. The sad part about that is that that particular patient will feel slighted.
And the feeling of being slighted is rightfully so. Everybody else in this process gets paid except the injured party. I asked the doctor, in his opinion, what could be done to help alleviate this problem.
I think that the policy limits need to be raised. I think more people need to look into riders such as MedPay to cover for, accidental injuries that come from auto accidents, or in some states it's called PIP, personal injury protection, or no-fault protection. Those can be starters. But I think also having a group of doctors that will be able to care for you at a reasonable cost. And there just needs to be more pressure on the insurance companies to give decent settlements where people can not have to worry about being out of work 2, 3, 6 months, worrying about their car being repossessed, their homes being foreclosed, there being no heat or air conditioning depending upon the season of the year.
Dr. Gadsden certainly raises some valid points, and he certainly has some words of advice for those of you looking for legal representation.
I think when you're seeking legal counsel to represent you, if you're involved in an auto accident or a slip and fall case or any personal injury case, you should ask that attorney, what is their level of experience? Have you ever taken a case to trial? Are you willing to do everything possible that is needed in order for that patient or that client to get the recovery that he or she so deserves?
To find out more about the Gadsden Chiropractic Wellness Center, call 770-246-0340.